with everything that's going on in the world right now, a lot of people, pretty much everybody, has been forced to do a little bit of personal inventory because, let's face it, over the last couple weeks, months even, we've been stuck inside our own heads because we can't go to the movies. Some of us can't even go back to our jobs. We can't go out for dinner. We can't visit family or friends. We can't do anything. So, what do you do in that situation? You live up here. That's just it. That's unfortunately that's what we're all doing. And it forces us to take a lot of personal inventory. What is going on in our lives? What we want to change about ourselves? What we want to how we want to approach life, how when things get better, how will we change, personality wise, will we have different views or will we be more open? There's just a million things that can be examined with personal inventory. But one thing that I have noticed across news and all forms of social media is that a lot of people now are showing love for the frontline care providers. It's like they didn't even give a shit about them before all this. It's sad when it takes a global catastrophe, when it takes a global pandemic to make people realize that there are people who work in fields that are basically, they're putting their lives on the line almost on a daily basis, and they couldn't give a shit less about them until you need them. I don't know how many people I have heard when this all started, when nurses were saying there's no PPE and like long-term care facilities, hospitals, group homes, you name it. All were saying we don't have enough personal protective equipment. We don't have this. And people are saying, oh, well, this is what you signed up for. This is what you wanted to do. Why are you complaining? I don't remember ever, no, I've never met anyone, and I personally never raised my hand when my teacher in school asked, what do you want to do for a living? And I'd go, hey, I know what I want to do. I want to work in a long-term care facility or a hospital during a global pandemic and be short of the things we need to stay safe. I don't remember that. Now, I am a frontline care provider, and for myself, I don't use that term loosely, but when it comes to degrees of difficulty, when it comes to frontline care providers, doctors, nurses, people who work in long-term care facilities, they're at the tippy top. I'm kind of hovering around the middle. I work in a group home for adults with developmental disabilities. Now, we can't go anywhere. We can't go on any trips. We can't go to any stores. So we're pretty much stuck inside the whole time. So it's relatively safe in a sense, but there is degrees of, never mind. I won't get into that, but I am a frontline care provider. Again, maybe not up to that level, but needless to say, it offends me. It offends me now that it takes this long for a lot of people to show the kind of respect to frontline care providers that they deserve. And I'm not just talking about myself. I mean, you can say, oh, good job, pat on the back, whatever. But the people who deserve the most respect are the people right now who are probably testing positive for COVID-19 and still trying to save people's lives, even though their own is at risk. And it's just offensive. It's sad. And I'll say it again. It's sad that we live in a world where a global catastrophe needs to happen. A global pandemic needs to happen in order for us to start appreciating the people who care for us and care for our loved ones and make sure that we are safe, that we are healthy, that when our lives need saving, they're the ones that help save it. Too many nurses, too many doctors are getting sick. Too many nurses, too many doctors, too many frontline care providers in general are being overworked, underpaid, overstressed. And do you think for 1 second that your praise is going to make them feel better? Yeah, it might help a little bit, but you know what will help more? Everyone. And I'm not just talking about people out on the street. I'm not just talking about society, but government especially. Now, a lot have stepped up. And you know what? I wasn't a Doug Ford fan when he first got elected. I thought he was kind of a fucking drunken idiot, but he's actually doing a decent job. He's standing up for healthcare workers. He's standing up for all essential workers. It's fantastic. He's he basically told he was asked a question when we're going to open the borders to the U.S. or something along those lines. He shut it down right away. He didn't even hesitate. He's basically he's bitched and chewed at Trump for blocking personal, I think masks or something were coming from the States, and Trump blocked the truck from coming across or said it wasn't doing it anymore. And Ford gave him shit. And yet they were apparently like, buddies before, but this guy's actually standing up. And we need more of that. Not just now, but when things start getting better. We not only need to show appreciation for frontline care providers now, how about afterwards? They need it afterwards too. Not just now and then we just go back to the norm. I'm talking about months, years down the road. Everything's back to normal, and I can go in an emergency room and not hear someone bitch and complain, oh, I'm waiting so long, what's wrong with your hospital? God, the nurses don't know anything. That's sad. It's sad and it's pathetic. And anyone who does that and anyone who thinks that should be pushed off a bridge. I have interesting ways of solving problems. I wouldn't do it personally, but let's just say if someone was showing it on YouTube, I'd tune in to watch at least the initial shove. Not gonna lie. But I'm asking everyone. I'm not going to tell you what to do because right now there's enough people telling you what to do. I'm just going to ask. Not just now, but when this is all over, that every single person who worked frontline care, whether they be at a hospital, long-term care facility, retirement home, group home, day program, it doesn't matter. All of them. And not only that, but everyone who was labeled as an essential worker. Not only do they get recognition for doing what we're doing, but we get paid better. We get hazard pay out of this. We get notoriety. We get respect. Because there are people who can barely scrape together rent, who are putting their lives on the line on a daily basis by showing up to work. Is that fair? There are nurses working double shifts who haven't seen their kids in months because they shipped them off to their grandparents so that when the nurses come home after a day of work, that they're not possibly exposing the rest of their family to this. Those people, they get the recognition they deserve. I'm not just doing it for myself. I'm not asking for a pat on the back. Just show some fucking appreciation. And if you gotta raise their wages, again, not just myself, but any essential worker, especially healthcare essential workers, not only do they deserve better pay, they deserve better quality work environments. They deserve to have basically warehouses all across Canada stored with enough PPE to last us 3 Armageddons. And not only that, they deserve the respect of society. Because I'm not going to lie, there were times before I became a frontline care provider that I didn't respect them because maybe I had to wait in an emergency room for too long. Maybe I thought, oh, their jobs are easy. It's funny how a mind changes when you actually have firsthand knowledge of it, when you actually see the kind of world they're living in. And now we're all seeing the kind of world they're living in. They have to pop a tent to put people outside, put them in that tent, just because there's no room in the hospital. Should we have hospitals like that in Canada? We're a developed nation, for God's sakes. Should we have hospitals that invest more in healthcare, invest more in your healthcare workers, invest more in your essential workers? Because they're putting their lives on the line on a daily basis. Isn't that worth a high five? Or a raise? Or a better work environment? Or a safer work environment? Is it also worth actually having higher ups who listen to doctors and nurses and everyone else in the medical field when they say that something bad can happen and is going to happen and we are not prepared. When they say that, we deserve to have people up top who listen. They're listening now. It's just too bad they're too late. We will get through this. The whole scientific community is on board. We will get through this. We will find a cure. There will be treatments. There will be vaccines. We have to wait a little while, but things will get back to normal. We'll be able to sit on our couches on Saturday night, watch Hockey Night in Canada, or grab a beer, sit on the couch Sunday afternoon and watch the NFL on Fox. Those days will be back. We'll be able to go to baseball games, hockey games. We'll be able to go to movies, restaurants. Life will return to normal. But when our lives return to normal, let's make the new normal for everyone's health be at such a high standard. If something like this comes down the pike again, not only will we be ready for it, but we will snuff it out before it even has a chance to breathe. I'm hoping so.